Good day to all. In today's video, let's discuss about hemagglutination. The blood type of an individual is based on the presence or absence of the antigen, which is binded over the cell membrane of the RBC. So, it might be A antigen or B antigen, or some person may have both the AB antigen, or in some cases, the person will not be having any antigen over the cell membrane of RBC. So, based on the presence or absence of these antigen over the RBC, the types of blood is differentiated as A, B, AB, and O. So blood is characterized into different blood groups based on the presence or absence of the antigens or agglutinogens. So the ABO blood grouping is characterized by two glycolipid antigen, which is called as A antigen and B antigen, depending on whether the RBCs have none or only one antigen or either of A or B. Based on this, the blood group are distinguished as O, A, B, or AB. So agglutins are antibodies that react with these antigen, whatever I've mentioned earlier. So they are absent in newborn, which means the agglutins are absent in the newborn. The ABO antibodies start appearing in the plasma only after the age of 3 to 4 months due to cross reactivity of ABO antigen present in naturally occurring bacteria, viruses, and other pollens from the environment. So these antigens are absorbed into blood and stimulate the formation of antibodies against antigen not present in the infants. So those antigens that are recognized as non-self by the body immune system. So here is a diagrammatic representation which shows the differentiation between all the four blood type A, B, AB, O. Here you can see that in group A, the RBC cell is bounded by antigen A, and in group B, the RBC cell membrane has antigen B, and in group AB, it has both the antigen A and antigen B, and in group O, it doesn't have any antigen over the cell membrane of the RBC. So hence there is an antigen A, the plasma has antibody B. So it doesn't allow the B antigen to enter into the RBC cell. So hence here in B group, it has a B antigen. It has an antibody for A. So in AB group, hence it has both antigen A and antigen B. It doesn't have any antibody for this group. And in O group, hence it doesn't have any antigen over the RBC cell. It has an antibody for both antigen A and antigen B, which means it has both antibody A and antibody B. And agglutination. So, if someone receives blood from a wrong or a different blood group, the immune responses and encounter the foreign antigen where agglutination occurs. So, agglutination it's a clumping reaction of RBC due to a binding of antibodies to antigen that causes the blockage or even it leads to death. So agglutination reaction in which antigen antibody reaction in which antibody is cross-linked particulate antigens resulting in the visible clumping. So agglutination of RBC is known as hemagglutination. The target antigens are present on the RBC. So for example, if a person is having an A antigen over the RBC, which means A group person is receiving a blood from a B group person, which means it has a B antigen, antibody anti-B will react and it form a clumping, and it immune response reject the antigen A. So this form a clumping reaction or it form an agglutination reaction. So it will only receive a blood from the same antigen type. So if a person A group is receiving a blood from B, it doesn't accept it, or it forms agglutination or clumping, but it receive an antigen A, which means it receive A group blood with no agglutination or clumping. On the presence and absence of the antigen over the RBC, one can donate or receive the blood. So blood group A, B, which has an antigen both A and B, an antibody none, because it has both antigen A and antigen B. So they can give blood to AB, and they can receive blood from AB. So when they give AB, it doesn't react or it doesn't form agglutination. A antigen will bind with A and B will bind with B. So A can again bind with A, and B can also bind. So O can also give because it doesn't have any antigen over the cell, so it doesn't cause any reaction here. And blood group A, which has an antigen A and antibody B. So A group can donate blood to A and AB, and they can receive blood from A and O. O can donate to any type of blood, hence it doesn't have any antigen to react with any. So blood group B, which has an antigen B and antibody for A. So B group person can give blood to B or else B. Why we are giving here to AB is that the B antigen will accept B, because in AB it has a B antigen already. So B can receive blood from B or O. O antigen, it doesn't have any antigen over the RBC cell, and it has an antibody for antigen A and B. So hence it doesn't have any antigen over the cell. They can give blood to AB, A, B and O, and they can receive blood only from O group, because it doesn't have any antigen. But when they give AB, give them blood, the B antigen and A antigen will react, hence it doesn't have any antigen. It has an antibody for both A and B. So this will react with A and B and form a agglutination. Rh factor. In addition to antigen of ABO system, the red blood cells of human also contain an additional antigen called Rh antigen, which is a rhesus factor. So there are several varieties of Rh antigen like C, D, E, and D. And here among this, D is most potent, and this is most common. So therefore, Rh positive person is also called as D positive, and it might be Rh positive or Rh negative. So, however, there are no naturally occurring antibodies against RHD. So, the RH factor and or the RH antigen is not present in the body fluid and tissue, but they only present on the red cells. So, clinical significance of Rh factors are, although there are no natural anti-Rh antibodies and they never develop spontaneously, they can produce only in Rh negative person. So, this can happen in either two ways. So, in transfusion, when an Rh negative person receives Rh positive blood, there is no immediate reaction because there is no antibody for this. But after a few weeks or few months, or he or she produce an anti-Rh antibody, so that will remain in the blood. And however, within few weeks or even years later, the second Rh positive blood is injected, the newly donated red blood cells will be agglutinated and hemolyzed, so that's resulting in the serious transfusion. So, in transfusion medicines refers to the test that is performed prior to a blood transfusion in order to determine if the donor's blood is compatible with the blood of an intended recipient. So, cross matching is also used to determine compatibility between a donor and recipient in organ transplantation or blood transfusion. Universal donor and universal recipient. Since type O person do not have either A antigen or B antigen on their red blood cells, they are called as a universal donor because their blood can give one to all four types. They can O group can even give to O group, B group, A group, and AB. So type AB person is also called as universal recipient because they do not have circulating agglutins in their plasma, and thus it doesn't cause any agglutination reaction. So therefore, they receive blood of any type. ABO incompatibility rarely produce hemolytic disease of the newborn. So ABO incompatibility between the mother and the fetus rarely causes hemolytic disease of the newborn. So the reason is that the anti-A and anti-B antibodies belong to IgM type of gamma globulins that do not crosses the placenta. Here, the test is done, and you can see the differentiation in all the blood groups where the agglutination reactions happen in different antigen. So here the agglutination is formed in anti-A and D, which means the blood group is A positive, and here the blood group is B positive. So D is for RH. So this is anti-A, which means it forms a agglutination with antigen A, and here it forms a agglutination with anti-B, which is antigen presented is B. So here the agglutination forms in all the three antigen, which means it is A, B positive. So here there is no clumping or there is no reaction in all the three antigen, which means it is O negative. If it forms an agglutination here or it shows positive in anti-D, then it will be O positive. So this is about blood grouping procedure. Thank you.